Veneers are a big decision, and the last thing you want is to regret them. And by now, you've most likely seen mixed opinions online. Some say they're life-changing, others say they're a mistake. So today, we're cutting through that noise and talking about 3 things that matter most: cost, pain, and recovery. But before that, let me clear something up. When people hear the word veneers, the first thing that pops into their head is usually those big, blinding white square teeth. So when patients come into my San Antonio office, one of the very first questions they ask is, are veneers fake? Or am I gonna look obvious? And I realize that the reason those questions even exist is that most people don't actually know what veneers really are, because all they know is what they see on social media. So let me clarify. At their core, veneers are ultra-thin porcelain shells that are custom designed and bonded to the front of your teeth. They're not supposed to be bulky, and they're definitely not one size fits all. Their whole purpose is to improve either your tooth shape, color, size, symmetry, or any combination of those. And the end goal? It's to enhance your smile and make it feel natural on your face. So, if you're considering veneers, the first thing you need to understand is this. Veneers should correct the things that have been bothering you for years. You know, the stains you can't fix, or the chips you keep hiding, or the gaps that show up in photos. When done the right way, they will just look right, not fake. Once you understand that, everything else like the cost, comfort, and recovery starts to make a lot more sense. But don't worry if you're still on the fence about it. I know making this decision is huge. So if you ever need more clarity on your treatment, or if you simply want to know what you're getting yourself into, you can reach me in my San Antonio office. The link is in the description. Because the truth is, research can only get you so far. One of the biggest mistakes I see people make when it comes to veneers is assuming there's a best type. They usually come into the office and tell me, I heard porcelain is the only good option, or I want no prep veneers because I don't want my teeth shaved down. And I understand where they're coming from. They're merely trying to protect themselves. When all is said and done, the right veneer depends on your specific case, not a headline or whatever you read online. But let me elaborate on each type. That way, you have a better understanding of every single one. First, there's porcelain veneers. And these are what people think of when they hear the word veneers. They're custom made in a lab, designed specifically for your face, your bite, and your smile goals. So the advantages are clear. They look the most natural, they're extremely stain resistant, and they can last 10 to 15 years. Sometimes longer when done well and cared for properly. But the thing is, to get porcelain veneers, we typically need to remove a thin layer of enamel, which is a step you can't undo once finished. Then there's composite veneers, and these are usually done directly in the office, often in one visit, and they're more affordable up front, which makes them appealing to a lot of patients. But I want to be honest with you, because while these sound promising, I don't believe they're a great long-term solution. In my experience, they usually last 5 to 7 years, sometimes even less, and they tend to stain more easily, wear down faster, chip more often, and require more maintenance over time. Despite these, I don't think composite veneers are bad either. I just think they need to be chosen for the right reasons, usually as a temporary or transitional option, not something you expect to last for decades. Now, let's talk about the most misunderstood category: no prep veneers. You might hear some dentists say, they're amazing for everyone, and others might say, they're only a gimmick, they'll never last. Well, if you ask me, I disagree with both of those statements. Because there's no prep veneers that can be excellent long-term solutions, but only with ideal case selection. Meaning, if someone already has smaller teeth, natural spacing, minimal crowding, and a bite that allows it, then no prep veneers can perform just as well as their traditional prep counterparts. But again, they're not for everyone. So trying to force no prep on the wrong teeth is one of the fastest ways to end up with fake looking results. For that reason, there isn't really a good or bad type of veneer. There's only the right option for you. And once you understand which type of veneer makes sense for you, the next big question naturally comes up. Do veneers hurt? I appreciate that question because it tells me someone isn't just chasing the end result. They actually want to understand the process. So here's my unfiltered answer. The biggest pain in the butt during any veneer treatment usually isn't your mouth. It's sitting in the dental chair for a few hours. I know that sounds almost too simple, but it's true. Most people are way more uncomfortable from being still, holding their jaw open, or being mentally active for that long, not from actual pain. Let me explain. During the procedure itself, We use local anesthesia when we're doing any enamel preparation. Because of that, most patients don't feel any pain. What they feel instead is pressure, vibration, or movement. And for the majority of patients, the experience is surprisingly smooth. In fact, a lot of people are so excited once they start seeing the transformation that any minor discomfort completely fades into the background. But I'm not gonna sit here and tell you it's 100% risk-free or that this is the case for everyone. Because a small percentage of patients can still experience tooth sensitivity during treatment, sensitivity to hot or cold after treatment, mild gum soreness, and an adjustment period that lasts a few days. And yes, while they are unfortunate, these symptoms are still normal. Remember, we're using burrs on teeth, changing the tooth shape, bonding materials, and working on gums. So there's always a chance of temporary discomfort. And for most people, that short-term discomfort is a very small trade-off for the long-term results they've been wanting for years. Because while the process isn't perfect, what's on the other side of the mountain is worth every bump in the road. And that's something I want you to think long and hard about. Are you ready to take on everything that comes with veneers? If so, you know where to find me. Just click the link in the description to book a consultation here in San Antonio with me. And while you're pondering on that, let me explain something to you. Because if you've Googled veneers for more than 5 minutes, you've probably seen the numbers all over the place. And that alone can make anyone freeze. So instead of throwing out a price, hoping for the best, I want to tell you what actually drives the cost. All right, to start, the numbers you see on the screen aren't random. They depend on very real factors, like the material being used, the skill and the experience of the dentist, the number of teeth being treated, the complexity of your case, and yes, the standards of the practice and the lab work involved. That's why you'll see such a wide range online, because you're not really comparing apples to apples. But that's just the beginning, because there's a nuance people miss, especially when it comes to different types of veneers. In general terms, porcelain veneers are a higher upfront investment and tend to last much longer. Composite veneers, on the other hand, are usually lower cost and have a shorter lifespan. That's the simplified version, and that's where the internet gets it wrong. I've seen posts saying composite veneers are cheap. Yes, they're usually less expensive, but there are true masters of composite out there, artists, and those dentists know their worth. Some of them even charge more than what an average dentist charges for porcelain veneers. That's because exceptional skill commands a premium, regardless of the material. So price alone doesn't tell the full story, which is why I want you to keep this in mind. Veneers are not a necessity. They're a luxury, elective service. And luxury means time, intention, and resources. So if someone's looking for a fast and cheap, that's not luxury. That's something else entirely. Of course, there's no judgment in that. It just means veneers may not be the right choice right now. For some people, coming up with time and money is easy. For others, it's a big decision, one they think about for years. That's okay. But if you fall into the second category, here's something that might help you out. Alex Hormozy talks about this. I don't know if you follow him. And it's the cost of not doing something. Well, what does that mean? Well, let's say someone spends $30,000 on veneers. And let's say they get 15 years out of them. Well, that's about $2,000 a year, or less than $200 a month. So the real question, would you subscribe to a $200 a month service that made you feel confident every time you smiled? Helped you show up differently in conversations? Made you more comfortable in photos? Opening doors socially, professionally, and personally? And helped you feel like yourself again? Or would you rather save that $200 and continue hiding your smile? That's one way to reframe the situation. Now, if you say yes to veneers, here's something you can look forward to. Because unlike other major, more invasive dental treatments, recovery after veneers is actually pretty uneventful. Plus, it doesn't take weeks or months. In most cases, people feel back to normal within a couple days. And if you want the same outcome, I usually recommend taking it easy on hard or sticky foods for a while. Also, let your bite and your gums settle. Give your mouth a little time to adjust. If you ever notice mild sensitivity or slight gum tenderness, that's completely normal. You should be back to your regular routine in no time. And another thing, veneers don't require a special, complicated routine. All you need are a soft toothbrush, a non-abrasive toothpaste, regular brushing and flossing, and consistent dental checkups. That's it. Just remember, if you can take care of your natural teeth, you can take care of veneers. But if there's one thing you need to be more conscious about, it's going to be your habits. Stuff like nail biting, ice chewing, and using teeth as tools can lead to problems. And if you grind and clench your teeth, especially at night, that could help spell trouble for you too. So wear a night guard and develop healthier habits. Because at the end of the day, Veneers aren't scary, but they're not magic either. They're a powerful tool that can really bring out the best version of your smile. And if you've been considering veneers for a long time, but feel overwhelmed or unsure, that hesitation is understandable. This is a big decision after all. But understanding the process is only part of the equation. The other part is knowing what happens after, how long they actually hold up, what affects their lifespan, and what realistic expectations look like over the years. In this next video, I'm giving you the honest answer most dentists avoid about how long veneers actually last. Watch it right here.